Good afternoon, everyone. We just wanted to give you an update here regarding COVID-19. I'm here with our health manager, Regina, and we're just going to go through some of the concerns that we have regarding the third wave that we're in right now, all across BC and Canada, actually. We know that COVID-19 is on the rise in close to our community and all over BC. There are confirmed cases in Vanderhoof, so we're recommending that if you don't have to travel, we'd like you to stay in Saik'uz or your community unless it's essential travel, medical, anything like that is important. Medical appointments, hospital emergency, grocery shopping, medication pickup. Otherwise, we'd ask you to stay as close to home as possible. We know it's really difficult right now because the sun is out, and I think it's fine to go to town to ride your bike or go for a walk at the park. I think that's fine as long as you practice social distancing and you're keeping yourself safe and keeping your family safe. Do not visit indoors with anyone who does not live with you. Exception: if you live alone, you can have two people to visit indoors with you. They must always be the same two people, so they have to be in your bubble. And we don't want we don't have you don't have to wear a mask when visiting with those two people who are living with you. You can visit outside with the same 10 people, wear a mask and social distancing when visiting outside. Allowed activities are going for a walk or a hike, parents carpooling kids to and from school, grandparents providing childcare, welcoming a child home from university. And we want to remind the community that there's still a no visitors rule right now for Saik'uz. Those who do not work or live in Saik'uz are not to come into the community. So we just remind you to try to follow that as best you can. We did have a couple of scares of cases in Saik'uz. So far, we've been really blessed not to have COVID in our communities. There's other communities where they've lost many members because of COVID, and we really want to try to keep those numbers to absolute zero if we can. So we're just here to remind you just to be safe and keep washing your hands, wear your masks. It's to wear a mask. People some people are upset, but I'm protecting the people who are around me when I'm wearing a mask, and that's one of the main reasons why they want you to wear a mask, is you're protecting others and not only yourself. Yeah, thank you for listening, and be safe and be kind. And Regina will give her update. Thank you.
Thanks, Pris. Good afternoon, everyone. I hope everyone's well. I'm here to give you an update on 3 points vaccination. So 48% of our reserved allowable age was vaccinated last month. So we held 3 days of vaccination here at the gathering space. We also held 2 flash clinics for people that needed to be vaccinated. So as Chris said, the variant out there is rising, the numbers are rising, and the variant is along with that. So the COVID vaccine that we all received, Moderna, is effective in this new variant, but as time goes on, as it keeps mutating, the variant somewhere along the line, and I'm hoping it won't happen, that the vaccines out there, they may become ineffective. Right now they are effective, but I'm just putting that out there to please remain home in the community if you can, to stop traveling. That means going out of our northern region, our health region, to for non-essential travel. So that means no visiting. Like Chris said, our community is still closed to visitors. It's really essential that masking up and washing our hands are still one of the best ways to prevent the spread of COVID and the new variant. On that front, so for the second dose of the vaccine, we will be receiving that in about 3 months' time, and I'll be notifying community as soon as I get word that we will have the second dose of our vaccination. For those that missed the vaccine or had a change of mind to receive the vaccine, you can register with Northern Health to receive the vaccine. On another front, the opioid crisis that's ongoing here in our communities and many other communities. It's been 5 years since it was declared an emergency, and it's really been a difficult one here for us in Saik'uz. A lot of our members have departed to the spirit world, and we recognize that. And one of the preventative measures here we're taking at the health center is if you're needing a naloxone kit or a harm reduction kit, you can call the health center, you can drop by and come and get one of those kits. And if you're needing training, one of the wellness staff or the CSFS nurse will provide you training for the naloxone use. A few of our community members have expressed that they want to see this happening. It's happening, and it has been at the health center, so come on over. If you can't make your way over there, just give us a call, and one of the wellness workers will drop a kit off to your door. For the funerals and weddings, we'd ask all community members to please call the health center, and the CHR will provide you with a form to use to keep track of the visitors that are coming in and out of the community. This form will be used only for contact trace purposes only, and will be shredded within when COVID is done or when a 6 mark is over. And so if there's any other services that you may need during this time, please call the health center, and one of the staff will assist you.